Also at the Capitol today, paramedics, EMS, and EMT first responders from across the state met with lawmakers with an urgent plea for help.
We have never, ever even been remotely close to this level of a staffing shortage.
ABC 6 News reporter Emily Pofall is live outside of St. Mary's Hospital tonight after talking to first responders in our area. Emily?
James, Laura, EMS workers at the Capitol today said that they're experiencing more calls for service with sicker patients, but they're losing staff faster than they can replace them.
64 male COVID positive, unresponsive.
Any industry that cannot retain its youngest workers is not set up for a sustainable future.
Members of the Emergency Medical Services Regulatory Board speaking to reporters at the Capitol Thursday. Since 2018, 65% of EMTs who let their credential expire were under 40 years old, according to the board. A troubling statistic because as EMTs retire, there won't be enough young workers to replace them. The board says the biggest issue, low pay. Rural EMS, like Dodge Center Ambulance Services, rely on volunteer positions because of poor funding.
We're just barely getting by.
Angie Jarrett is the director at Dodge Center Ambulance. She says one of their biggest problems is that government insurance like Medicare or Medicaid reimburse ambulances less than private insurers.
They don't see ambulance as health care. They deem us as transportation. We're often only reimbursed at less than 40% of what that actual ambulance bill is.
Policy like that means the paid positions are few and far between. And Jarrett says at Dodge Center, volunteer positions only pay $3 an hour.
The eventual goal is to move away from volunteer positions and move to full-time paid positions.
Yeah, that would be the pipe dream. They deserve it. They deserve it.
Other priorities include more reimbursement for licensing fees and high school EMT programs to get more people interested in becoming first responders. James, Laura.